just letting moms know that they're not alone, that what they're experiencing is the second most disabling disease in the world, and that there are treatments. There's things that we can do to help them manage this disease state.
Welcome to the Sharing Passion and Purpose podcast, a weekly podcast providing career and creative inspiration to help you build a purpose-filled life. If you're interested in tapping into your creative potential, pursuing a career with passion, and building on your biggest and best resource, yourself, please join me on this path. I'm your host, Nancy Moore, and I want you to know that I'm on this journey with you. So let's get started. Dr. Jaclyn Duvall is a native Tulsan who knew from an early age that she wanted to help people. Growing up with a mother suffering from multiple sclerosis fueled her passion for pursuing a career that could make lives better. As you'll learn, she pursued medicine, even securing a fellowship to learn and train at the prestigious Mayo Clinic. And you'll hear she also authored a book during that time, her time at the Mayo Clinic. And you'll hear some tips on how she organized her time to accomplish this. Dr. Duvall is a neurologist with a specialization in headaches, and so you'll learn the difference between a headache and a migraine, and yes, there is a difference. And you'll also hear about her new endeavor, opening a medical practice, and how it really is a family affair as she includes her husband and kids in the process of building this practice. So I hope that you enjoy this conversation with Dr. Jaclyn Duvall. So, Jaclyn, I am so happy to be visiting with you today and am so honored you have taken the time to come and share your knowledge with my listeners. What we're going to be talking about is something that's close to me because I suffer from sinus stuff, and maybe now I'm going to find out it might be something different, but anyway, I guess we'll find out as we talk.
Yes, it might be. Thank you so much for having me. Yeah. I'm really thrilled to be a part of this.
Yay. Okay, good. So if you'll tell us a little bit about yourself. I know that you're a mom. You have a family, so we both live in Tulsa, but if you'll kind of tell us a little about yourself.
Absolutely. Well, I was actually born and raised in Tulsa, Oklahoma, so I really felt like I always wanted to come back home. As a native Tulsan, you kind of get drawn to this community, and having my kids now grow up in this community is just awesome. So I have two littles. I have a son who is 8 and a daughter who is 6, and they keep me busy. My husband is also from Tulsa, and so we love our little family here.
How neat. Yeah. So you're in medicine. You pursued a career in medicine. You decided to go to medical school.
Well, I went to undergrad, and I was part of the medical humanities program. So I've really known I wanted to be a doctor since I was little bitty. Mm-hmm. When I was first little and we had our first career fair, my dad said, what do you want to be? I said, I'll be a clown. And he said, I don't know, maybe something you could do more help. And so my mom has multiple sclerosis and has since a little after I was born. So he said, well, being a doctor means that you would help people like your mom. So for me, it always became, I'm going to be a doctor. I'm going to help people. And that was really all of high school. I knew I wanted to be a doctor. Anytime we got a chance to, go out in the community or shadow someone, I was in the hospital or in the doctor's office. So I had a passion for that. And I was fortunate to be accepted into a program called the Medical Humanities Program, which sort of links all aspects of medicine, not just the science, so the art of medicine and doctor-patient communication and healing in non-medicinal forms. So then I went on to OU Medical School, and really there is when I fell in love with neurology, which sort of made sense given my mom's history. So.
Okay. Yeah. Well, it's interesting specializing then in neurology. So after your time in medical school, you had an opportunity, or if you could tell us about your opportunity that came about with the Mayo Clinic.
Yeah. So straight out of residency, I was sort of burnt out on academic medicine. I thought I would go on to pursue a fellowship in multiple sclerosis. I really thought that's where my passion was. So I went out into private practice at Mercy in Oklahoma City. And while I was there, I discovered I didn't love treating MS. I think it was just a little too close to home for me. And a win in multiple sclerosis at that time was really preventing disease progression. It wasn't getting someone better. And so sort of kept seeing that pattern, and I found myself looking forward to treating people with headaches. They were my very similar demographic. It tends to affect young women during childbearing years, and it can be quite disabling. And I found out that I was really giving people days of their life back, which I liked. I liked reversing that disease process. And so I kept looking forward to my patients with headache. I remember the early conversations with my husband of, I think I want to do this full time. I only want to see headache. And so he really kind of spurred me. At the time, one of my friends from residency was going on to headache medicine at Harvard. It's like, gosh, he's doing what I want to do. And I can't believe it. I think I could have that opportunity. And so my husband said, you know what, you've got to do it. This is your passion. This is what you want. And so I was fortunate enough to be accepted to Mayo. And whenever I had that acceptance, I was just in shock. It was the opportunity of a lifetime that I'm really blessed to have had.
It really was. So what are some takeaways from that experience at the Mayo Clinic?
Oh my gosh, everything. The way that I approach patients, my knowledge base across my time there, the case exposures from around the world that maybe some headache doctors have had, one or two patient experiences. While I was there, I had an opportunity to work on a research project where we reported about the largest case report of a very specific headache condition. And getting exposure into that, again, was just something that I would have never encountered. And in fact, before my headache fellowship, I thought I had this vast knowledge, and then you realize how much more you still have to learn.
Mm-hmm. Yeah. Well, and being at the Mayo is such an honor, in itself, but you do, I'm sure, see cases that are maybe the hardest cases.
It really is. So that was another aspect, and I think my history of my mother and seeing the doctor, I made a point to walk through the patient entrance of the Mayo Clinic each day that I went there, because you walk into the patient entrance and they have these, blown glass on the ceiling and a piano player playing every day. And you realize for that individual, that's their one chance at the Mayo Clinic to get that quality health care. And so it's so easy for us to go about our daily life and just, okay, another patient on the list. But I really wanted to remind myself what a gift it was, but also that it was that individual's one chance. And even if it was my 10th of the day, to focus in on that. And I try to take that back in what I do for my patients now.
I can't believe they had, was it like Chihuly blown glass?
It's like that same, I can't even remember is it the Venetian in Vegas that
or
has
one
on
of
the ceiling? Yes. But it's stunning. It's all hand blown, and you go in, it's just this gorgeous, you walk into the Gonda, and it's just beautiful.
So they're surrounded by beautiful music.
Oh, it's unbelievable.
Sights.
There's art. There's a gallery. It tells the history. It's a beautiful place, where really a lot of healing takes place.
Okay, that's neat.
It's incredible.
And it's interesting that you chose to go that way.
Yeah.
And to experience that and keep that reminder of your why you're there, and who you're working with.
Yeah, I just think it's so easy to get caught up in the day-to-day and, the grind of the next day. And this is what I did yesterday and doing it again. So for me, that visual reminder and honestly, just not to take a day for granted from my education or learning was important.
Yeah.
Yeah.
So now after that experience, you were offered a position at the Mayo.
I was.
And so tell us about that. and how that because that's kind of a point where you say yes or no, and that shifts your direction in life and your trajectory. So if you can kind of talk about that and your decision, and then where that went after that?
So that was a hard decision because we loved our time in Rochester. It's just such a unique little family town of really incredible people. You would guess that you're at this educational center and you're going to have a lot of pride or arrogance surrounding you with some of the world's leading doctors. And honestly, there is not a more humble group of people. I mean, I was working on a project with a neurosurgeon who I didn't even expect to respond to my emails, in sort of my experience in medicine. And not only did he respond like instantly, then he shot me a message and said, hey, why don't you just come down to my office so I can go over these pictures with you and show you exactly what we're looking at. These people that are just incredible. Mm-hmm. So Mayo, from like a collegial standpoint, is incredible. The location, we loved it. But my purpose when I went there was to develop a comprehensive headache clinic back home. Mm-hmm. And so for us, our family is here in Tulsa. I really wanted my purpose to be to have a referral center here and to be able to take care of our community. And so as hard as that was, we're really thrilled to be back in Tulsa and we love it. I miss Mayo and I miss the people that I worked with there. And I think I always will. But
to have that experience is such, just such a incredible time for you learning and growing and developing you and, in your life and your practice. And so.
Oh, absolutely. I'm so grateful for that opportunity. At the time it felt like a lot. We uprooted our whole family and, moved, and my husband quit his job, and so it felt like a lot to leave everything we knew, but I wouldn't have taken it back for anything.
Yeah, that's neat. Well, I'm glad you brought all that knowledge back to Tulsa, though.
Thank you.
And you're here and we're getting to talk to you. So, okay. So now, if you could kind of share a little bit about the information between a migraine and regular headache?
Yeah. So this is always an interesting question because we hear what's the difference in a headache? And the truth is that headache is sort of this all-encompassing term. It's not really a medical diagnosis. It just means head pain. And so then we sort of parcel headache into two big categories, either a primary headache type, which doesn't have anything that causes it. It's sort of genetically inherited or predisposed. And then we have what are called secondary headaches, which are caused by something, an infection, a stroke, a tumor. And those are the things that we do diagnostic testing. We make sure that none of these are there. And then we hone in on the primary. And so the three major types of primary headaches people think about are migraine, sinus type headache, which I know we were talking about, and tension headache. And most individuals have had a tension headache in their lifetime. But what we think are sinus headache and tension headache most often are a form of migraine. It's just not the severe in bed, nausea, vomiting, lights out that we sort of box migraine into. And so we were talking earlier that sinus headache is probably the one that gets confused the most. And there's a number of reasons for this. So Dr. Richard Lipton is one of the world's leading epidemiologists. He's published more on migraine than anyone in the world. And he did this study looking at about 3,500 Americans who thought they had sinus headache. So you could have potentially qualified. And so he said he took sort of this questionnaire and then he diagnosed what they actually had based on all of our criteria. Turned out 88% of those were actually migraine and not sinus headache. So then the question becomes, okay, why? Why do we think this? Well, migraine is triggered by weather changes, barometric pressure. It's triggered by allergens. Migraine can be treated by sinus medication, what we call antihistamines. And then there's this bundle of nerves that sits at the back of the nose. It's called the sphenopalatine ganglion, and it's a branch of the trigeminal nerve, which is the major migraine generator of the brain. Well, when that little nerve gets involved, it causes what are called autonomic symptoms, and this happens in about 60% of people with migraine. These are things like sinus congestion, eye tearing, facial flushing, the nose runs. You can get blood pressure, heart rate changes, body temperature changes. And so when these sinusy type symptoms come up with frontal pain and the weather has changed, people think it's sinus headache. But the truth is that recurrent sinus headache in the absence of a structural deformity, like a nasal septal defect or maybe some polyps or something that are obstructing, those are quite rare to have them continue to happen. And so we think what most people are calling sinus headache may actually be migraine masquerading.
Okay. See, I think I might have to come see you now.
Okay.
Because I have for years suffered from what I have thought has been a sinus.
Yeah.
And it will get so bad to where it could turn into even a sinus infection, and I just go to my regular primary and have not looked into it, really past that.
Yeah. So it's very possible. And I see this not uncommonly that, okay, it's just a sinus headache, but we treat it with migraine medications and it responds, and migraine doesn't treat sinus disease. So.
Okay. So, I admitted to you before we started recording that I do a neti pot.
Yeah.
And you had some interesting commentary on that, and I'd love for you to share.
Yeah, so, a neti pot sort of increases dilation. It sort of just allows blood flow, and sort of that calming or effervescent can create a pain relieving response. But I think it's probably more like the dilation of the sinus space and even vasodilation that takes place that it's helping the headache. So that doesn't necessarily help us in diagnosing, is it migraine or is it sinus?
Okay. One of the things that caused me to reach out to you from your Instagram information was speaking to parents who suffer from migraine. And it's so hard when you have a headache. And I would swear that I've never had a migraine. I've had sinus, but anyway, again, but it's so hard when you have even a headache, and you're trying to, get dinner on the table or deal with the kids and that kind of thing. And so I found your response to, the information that you had on parents with migraines interesting on your social media. So I thought I would have you kind of share a little bit about that.
Absolutely. So I think, number one, migraine really impacts women of childbearing age. That's the highest population that's impacted. And so we tend to be very busy when we're in the midst of these. And the problem is oftentimes we put ourselves last, right? We're doing work, we're doing the kids, we're taking care of everyone else, and then our health goes to the end. And honestly, women are very resilient. We sort of push through in the midst of all of this. And so I speak with all of these parents who tell me they have these feelings of guilt, or they don't schedule things for their kids because they're afraid they're going to have to leave in the middle of it because they're having such a severe migraine. And it's so frustrating for them, but it's also just disheartening. I had a mom who told me she couldn't play with her kids on the ground. She had a 2-year-old, and when we had given her a migraine treatment, she goes, my son turned and looked at me and said, "You're playing with me." And I mean, we both have just streams, tears coming down, right? But she realized that was one of the first times she had been physically on the ground playing with her kids because her migraines had been so debilitating. And so I think just letting, moms especially, I just have a heart for them, know that they're not alone, that what they're experiencing is the second most disabling disease in the world. And that there are treatments. There's things that we can do to help them manage this disease state.
Okay, what kinds of things, maybe?
So we have a lot of different arms of treatment. So I have some women that come in and they're like, I don't want a pill. And so in that situation, we may talk about natural supplements that could be helpful to prevent, like magnesium, vitamin B2. We may talk about nerve stimulator devices, which are sort of the in vogue treatment right now because they don't have a pill. They're sort of stimulating the sensory nerves. And then some that really have progressed to the point that we need pharmacologic intervention, whether that's a daily pill preventive, a monthly injection, or even Botox for chronic migraine.
Okay. I'd fall in that category where I don't want to take a pill. I would try to do anything else, other than, and even more natural other than, just taking something. But sometimes it just gets so bad. It's just like that. That's just
It does.
What you've got to do.
Well, and I think one of the nice things is, our older medications came with a lot of baggage. And so I'll have a lot of women in your same scenario that go, I've tried meds and I don't like how they make me sleepy, or I'm nauseated, or I'm in this mental fog. But a lot of our newer medications that are very migraine focused don't come with that same baggage. So you can take them, and they work, but you can also continue to work. So I call it the work squared. We want it to work and you can take it at work, whatever your job may be. And maybe that's a stay-at-home mom. We want you to keep functioning through what you're doing.
Okay.
Yeah.
Yeah, good. Lots of options.
Yes.
So, okay. One thing you mentioned that I honestly didn't know even before you got here, but now I've got it. We've got to talk about it. So you mentioned you wrote a book, which is pretty awesome. So if you'll talk a little bit about the book that you have and why you wrote that.
Well, thank you. I wrote a book. I really started it while I was up at Mayo in my spare time, because I have all of these different aspects of headache and migraine that I want to share with every patient that I see. But I don't have time. I don't have 2 to 4 hours to talk about my whole, headache experience and knowledge. So I wanted it to be kind of this concise resource, but also a resource for individuals with migraine to give to their family members, to give to coworkers who may not understand what they're going through. It sort of explains the disease process and what's commonly experienced.
So, okay, I think people will find that helpful. So I will link that in my show notes and then on my website, so people can find that, have access to that. So it's interesting that you say in my spare time, because you were, doing a fellowship and you had kids at the time when you were writing the book, and you're married. So when did you have time? And I will say, because people will ask about, they want to do so many things, write a book, do all these things. So you were in the middle of a lot and you still found the time. So I thought, if you have any tips or secrets, I'd love to know.
So whenever I get these lofty ideas, because I like, continuing pushing the boundary of what's next and what am I doing, like opening our clinic this year. And so for me, it feels so overwhelming. Okay, a book, where do I even start? So for me, I always break it down into my simple to-dos. So I'll come up with, okay, step 1 was, what do I even want to talk about? How many different topics do I have? And then I would dictate as I was exercising. So I run a lot. And while I was up there, I was training for a half marathon. And so as I was running, and that's always when you get your best thoughts or ideas, right? I would have my phone there where I could quickly in a note, chapter 1, this, chapter 2, that, and you get these ideas. And honestly, then I also had someone who recommended keeping a notepad by your bedside table, because you'd wake up in the middle of the night, and I jot down like the best way to say that. And the next morning, if I hadn't written it, I didn't remember it. And so those little parcels of time, and then I really separated it and said, okay, this month I'm tackling just chapter 1. And then this month I'm going to do this. And I'll tell you, some months came much easier than others. I had some aspects of the book that I thought, I don't know how to write this, or, and so you get that writer's block, which I'm sure you've been through. And so at some point you just kind of have to sit down and get it done. And yeah.
Okay. I admire your tenacity, because that is how you get it done. Even despite everything you have going on, I like that you say little blocks of time, because 5 minutes doing that, every day adds up over the month, over the, year. And so, you finally have something at the end. And I like to utilize my time effectively. I try to be as efficient as I can. So I was thinking, it sounds like with everything on your plate, you kind of know, how to organize your time. So I appreciate you sharing that. So yeah, so people know. Yes. Okay. So if you'll tell people how they can find you.
Well, I have a website that I put together. It's www.hsoo.org. And I have, an email on there. My Instagram handle, which I got pushback from initially, is the OK Headache Doctor. So OK for Oklahoma. But I like the pun on that am I okay or not? Somebody can meet me and
I
find
always
out.
like the play on words.
Yeah.
Love it.
Yes.
Yeah.
So that's how you can find me.
Okay, good. And I'll link all of that too.
Okay,
so people
thanks.
have that. Yeah. Okay, so I know people can find you at hsoo.org, and that is your own practice that you have just opened, and it's fairly new. You opened it last January.
Yes.
So about, a little over a year old.
Yes.
So if you'll tell me about why you decided to go out on your own, because that again is very entrepreneurial.
Yeah.
That you've decided to do that because you're not, a business person, you're medical, but you've decided to, embark on your own. Yeah.
So when we moved back to Tulsa, I worked for Hillcrest, which was fantastic. They were wonderful to me. I had zero complaints about my employment with them, but it has always been my passion to own my own medical practice. And so at the time, we really were looking at just moving the clinic and me staying employed with Hillcrest, because our old clinic location was about 25 minutes away from my kids' school. And I felt like I was missing out on so much of their day to day. If they had like parent teacher conferences, I'd take 2 hours just to have that 30-minute meeting. Or if they had a school play or just picking up and dropping off, I couldn't drop off in the morning and make it to my clinic on time. And so we're really going to move location. And again, my husband was like, you know what? This has been your passion. There's never a good time, so you just need to step out and try it. And so in January of 2023, we opened Headache Specialists, and it's been a whirlwind. I mean, from June's storms and losing power and internet and this brand new, building, and we're out as entrepreneurs cleaning it up. And we've faced so many different challenges of a new business in such a short time, but it's been a big learning opportunity for me and growth, which I'm really excited about. So we brought on a nurse practitioner in September, which I'm thrilled about because that's also been a passion of mine. Headache access in Tulsa is horrific. Neurology access in Tulsa is very difficult. Generally 6 to 12 months as a new patient that you'll be waiting to see someone. So for me to educate a nurse practitioner to grow, the providers that we have to allow more care is huge. And that's ultimately been my dream.
Okay, I love that you shared about opening your own practice, and one of the major reasons why is to be there more for your family.
Yeah.
Because I think, and you can correct me if I'm wrong, but I think that the hours and the workload is in the medical field is what deters a lot of women from possibly pursuing that.
Yeah.
It's a long time in, medical school, and then even on past that if you're specializing, and so to be able to have some flexibility in your, work-life balance, I think is huge.
Well, so it's interesting, when we first sat down to consider the clinic, I wanted the kids to be a part of it because I knew, especially this first year, that my husband and I, because he's helping me with all of this, that it would be long hours and we would be up there on the weekends, and the kids have been up there sweeping the floors. Like, they have jobs that they do around the clinic. And so I wanted them to know, if we do this, the goal is that mom will have more time with you, but in the beginning we may have less time, or we may have all of us time together. Our weekends may look a little different. And so, but them understanding kind of what you put in on the front end in order to have, the back end of flexibility and freedom. So
I like that you included the whole family in that. It wasn't just you and your husband, deciding, and you had to get buy-in, I guess, from everybody. But
I will say that can be a catch-22, because now my son goes, I think you just need to go back to your old job if I'm working on the weekend or something. It's like, can you call them back up? I'm like, oh gosh.
Oh, that's funny.
So,
yeah. But as time goes on, because it has just been about a year, and it takes a while to kind of grow things and get in a flow.
Yes.
So especially, if you're doing a lot of it yourselves. So Okay. I appreciate you sharing that.
Of
That's
course.
great. Well, thank you so much for taking the time to visit with me, and I think it'll be a helpful conversation for a lot of people. So thank you.
Well, absolutely. It was my pleasure. Thanks for reaching out.
Okay, everybody, that's a wrap on this week's episode. I want to thank you for listening to the Sharing Passion and Purpose podcast. It means the world to me, and I'd love to connect with you. Please follow me on Instagram, Facebook, and LinkedIn at Sharing Passion and Purpose, and Twitter at Passion Sharing. Also, if you like this podcast, it would mean a lot to me for you to subscribe, rate, and review it. And as always, all my show notes will be available on my website, sharingpassionandpurpose.com.